Hi, my name is Winter, and this presentation has been created by Taylor, Emily, and myself, and we have chosen to discuss schizophrenia. Schizophrenia is a severe mental disorder which disrupts thinking, affecting language, perception, and sense of self. It includes psychotic experiences. Schizophrenia affects more than 1% of the population worldwide. It reduces the quality of life, life expectancy, and is associated with many comorbidities. The mean age of onset is 23 years old for men and 24 years old for women, and it's more prevalent in lower socioeconomic backgrounds. The etiology has not been fully elucidated, but it's a multifactorial disease caused by a combination of genetic and environmental risk factors. These risk factors include hereditary links, being born in winter, and others, and they are likely to impair neurotransmitter systems in the brain. So the stress vulnerability model suggests that vulnerability in a person increases the susceptibility to schizophrenia. Therefore, being a migrant or part of an ethnic minority group can increase your chances. So symptoms of schizophrenia include hallucinations and delusions, which is under positive symptoms, and anhedonia, lack of motivation, poverty of speech, which is part of negative symptoms. Cognitive symptoms fall under deficits in memory, attention, and other. The dopamine hypothesis suggests that positive symptoms are caused by the hyperactivity of dopamine 2 receptor in the mesolimbic region, and that negative symptoms are a result of hypoactivity of the D1 receptor in the prefrontal cortex. The serotonin hypothesis has been developed by assessing the effects that LSD and antipsychotics clozapine and risperidone have on the brain. So it suggests that the decreased levels of serotonin elevate negative and positive symptoms, and LSD and these antipsychotics also decrease serotonin, which helps develop this theory. So the glutamate theory suggests that decreased levels of glutamate induces positive and negative symptoms, and this is supported by how phenylcyclidine and ketamine antagonize glutamate levels and produce similar symptoms as schizophrenia. Two major tools used to assess people with schizophrenia are the DSM-5, which is a diagnostic and statistical manual of mental disorders. It's the most comprehensive, current, and critical resource for clinical practice available for today's mental health clinicians and researchers of all orientations. The Mental State Exam, or MSE, is used to help understand the patient's psychological functioning at a particular point in time in order to direct care appropriately. Nursing interventions are an essential part to providing good quality care to a schizophrenic patient. One nursing intervention is the mental state exam, which was explained before. Another is care plans, and care plans allow for a continuous and shared understanding of patients' care history. It allows for interdisciplinary communication and decision making, and continuity, quality, and safety of care for the patient. Other nursing interventions include education and group therapy. Antipsychotics are the first line of treatment and main form of treatment for schizophrenia. Antipsychotics mitigate positive symptoms, but unfortunately cause many adverse effects. When comparing atypical antipsychotics, clozapine, risperidone, and olanzapine, clozapine is more effective than them both, however induces more seizures and causes a lot of weight gain. Clozapine is, however, highly effective for treatment-resistant patients. Risperidone causes movement disorders and sexual dysfunction, and olanzapine causes weight gain and metabolic disorders, and is more effective than risperidone. Psychosocial interventions such as cognitive behavioral therapy has shown to modify dysfunctional thinking and behavior, and it's been proven to be beneficial in treating schizophrenia. These psychosocial interventions reduce positive and negative symptoms and increase social functioning. The impacts of schizophrenia are felt by the individual, the family, and community. Individuals experience a lot of stigma, and this is shown by an anecdotal quote that says, "I think the biggest problem in the beginning was admitting to old friends. I wouldn't tell anybody I had a mental illness and that I had spent time in a mental hospital." As schizophrenic patients are cared for by their families, families often experience significant financial burden, emotional, physical, and social health. is also impacted. People with schizophrenia often lose their jobs and are frequently hospitalised, and this disconnects them from the community. The clinical reasoning cycle is an essential tool that nurses use to care for patients. The steps include collecting cues, processing the information, coming to an understanding of the patient's problem or situation, planning and implementing interventions, evaluating outcomes, and reflecting on and learning from the process. By following these steps of the cycle, nurses will ensure that the patient receives the most holistic, optimal, and patient-centered care.